Good morning, everybody. Welcome to Dr. Tom's
Hey, gang.
Tuesdays at 10 Case of the Week. This week, we've got something special for you. So, Isolite is phenomenal and has shown it's very helpful doing restorative procedures. The question is, how does Isolite help during extraction? What Dr. Hirsch is going to do today is take you through how you can use Isolite during extraction. Now, before we begin, let me ask you, Dr. Tom, how are you?
Good morning, Rolando. I'm just great. Everybody had a great Valentine's Day. We are delving into a much better period in our time. It looks like COVID's starting to tame itself just a bit. So, yeah, we're all doing great. How are you doing?
I'm well, thanks. So let me
Super.
ask you this. When doing extractions, what are some of the stresses that clinicians are facing, dentists are facing during extractions?
Well, here's the thing about extractions. Extractions are like a box of chocolates. You never know what you're going to get. Oh, my God, is that so true? What you think is going to be simple sometimes turns out to be very difficult. What you think is going to be hard sometimes turns out to be very simple. But a lot of times you know these things going in. So today, what I'm doing is I decided to take out a couple of teeth, the upper deciduous second molars on a 13-year-old. They've been in there for a long time. The teeth were not mobile at all. And as you can see from the Panorex, the maxillary bicuspids are coming in at quite an angle. So these teeth had to come out. So I just decided to use Isolite to take these teeth out and kind of help me a little bit. So let's roll this video and I'll kind of explain what we're doing as we go through.
Awesome. Here you go.
So, first thing that we've got to do, we've got to have good access. And so, I could have a bite block in her mouth instead of the Isolite, and that would have been just fine. But the problem with that is that I would have had to worry about her throat and had to have a throat pack. So really the nice thing about this is just make sure you've got the tissue all loosened up, which we did here. And we just go in here once we loosen the tissue. And this tool is great. Here's tip of the day. Not my product. It is called the Physics Forceps, and it's a pediatric one. And a little bit of pressure right there. And most of the time with these Physics Forceps on these long spindly roots, you will get the long spindly roots that will come right out. But it didn't happen here. I broke 3 roots. Didn't think I was going to. I thought I was going to get really lucky and I was going to just be so proud of myself. Oh, I'm going to get this thing out and I'm going to show you how it all comes out in one piece. Nah, wrong. Did not happen. So we went in there. We took the follicle and took a scalpel and got the follicular sac removed.
And it looks like she's not having any problems keeping her mouth open.
Yeah, kind of the nice thing about this is I didn't have to say, open your mouth, open your mouth, open your mouth. And the other thing that was nice about this is, I can position the patient towards me to where I see best. And my assistant doesn't necessarily have to see. So anyway, here we go. There's the tooth right there. And then we've got root tips to dig out, which we did. And let's go on to the other side. Same thing, free up the tissue. I like to use a scalpel here. It just really severs all the fibers really nice and makes the delivery pretty terrific. And we have great visibility on this whole procedure. The same thing, I'll tell you about the Physics Forceps in a second. That's a pediatric Physics Forceps. We can use big ones, but the PETA one is really small. It's much less intimidating for kids. And you'll watch this thing pop in a moment here. There we go. See, it just popped. And I think, oh, great, this popped and everything's going to come out really easily, including all 3 of those roots. Wrong. Broke 6 out of 6 roots. And so this is another nice thing. You can see from the bleeding, you see how the fluid is being aspirated up into the, see, look at that, three broken roots. Remove the follicular sac. But you can go back and you can just see all of the blood is being aspirated up into the Isolite. The same thing as saliva. Everything just gets sucked right up. So the throat's protected, which If I was using a bite block alone, then I'd have to have a throat pack. And then my assistant would have to be in there continually aspirating in the back of the mouth. But here she can just concentrate on what she's doing. So it makes life easy for her, makes life easy for me. Don't have to worry about the tongue getting in the way. And now we have to go digging.
That's amazing. Wow.
There we go. Pop that out. You see, that one came out really easy. The other ones didn't come out quite that easily, so we didn't go through the whole part of this thing, but there it is. Right there. Should have picked it up with a cotton plier because it fell to the back of the mouth, but it wasn't a problem. It just fell down there, so I wasn't too worried about it. See it? Yeah. So I'm not all concerned that it's going to go down the throat at all because it's nicely packed. And we got the mesial buccal root that we were digging out and the distal buccal root, and I really had to work at these things. They were not easy to get out. So this one, as I said, like a box of chocolates, it took a lot longer than what I thought it was going to take. You just take your time. One of the things one of my mentors said, you go slower to go faster. So slow it down, take your time, don't rush. And there's another root tip. And eventually, throughout this whole procedure, we got all the root tips out, cleaned it out. And we were able to look at the tooth, which was now going to erupt unimpeded. We just did this last week. She came in a week ago. 13-year-old female, real nice girl.
Fantastic.
That's
all right, no more sensitive content. Oh my goodness. So in the course of doing extractions and you're using Isolite, stress, what are some of the things that you've heard or are stressful about that process?
Well, here's the thing. First of all, you have to make sure your patient's numb. So we have to control the pain with anesthesia. That's very easy to do, but you've got to have good access. You've got to be able to see what you're doing. Kind of the nice thing with when I use an Isolite, when I do extractions, of course, these are simple extractions that turned out to be a little bit more complicated. But I've got the entire mouth illuminated with light so I can really see, even though I wear a loop with a headlight, it's just a nice glow that's all the way around. So I've got great access and I've got great visibility. The other thing that we worry about is anything dropping down the throat. So we have to protect the airway. And the airway is automatically protected, so I don't have to put gauze in the back of the patient's throat that they're going to play with their tongue. And then my assistant doesn't have to be in there retracting anymore. And the tongue is always under control. It doesn't get up into my surgical field. Patients always like to go exploring with their tongue. And so that's not popping up into my surgical field anymore. And the other thing that's really nice is I'm not continually reprimanding the patient. Stay open, open your mouth, stay open. I never say it once to the patient. This goes in and I never say anything and I just concentrate what I'm doing. So it's just total concentration without worrying about blood, without worrying about the patient staying open, without worrying about the tongue getting in the way, without worrying about the airway. It makes it easy. And we'll take some other, on another video on some adult extractions, which are really a lot more fun.
So what are tips that you people regarding second molars, the ones that are all the way back, when they're running into light, way back?
The second molars are even all the way in the back. Not a problem. The Isolite goes right around there. It fits up into the hamular notch. It rests on the retromolar pad. So it's not even an issue. Everything is really well protected. The thing that's super is you can go in there. And oftentimes with an elevator, you can do an elevator extraction on those second molars if there's no third molar there. And that will just elevate out to the distal and you just deliver it with the forceps.
Good. And if worse comes to worse, you can always take it out. I've heard you say that too.
Yeah. I mean, we do that on occasion. If there's not enough room or things are in the way and you can't get it, take the thing out, stick it down to the side and put it back in when you need it. The one thing that I was going to tell you about is this little physics forceps. It's a little pediatric one, just like that. It's got a little bumper on the end. It's a lot less intimidating, especially when you're working with kids. So this is the physics forceps. LU, L-U, means lower and upper. So it's good for everything. Lowers, uppers, anteriors, posteriors, gets in the way. It's a super little instrument. You can get it from just about any of your suppliers. I got this one from Golden Dental. Salvin makes these things. I'm sure all of your bigger supplier companies do. Patterson, Shine, Pearson.
Awesome. Well, thank you so much for
Yeah.
that. That was absolutely cool. It's fascinating when you do things like that. I really appreciate it.
Mhm.
If folks who joined us, if you like this content, please let us know. If you could share it. If there are other things that you'd like to see or questions that you have for Dr. Tom Hirsch regarding his cases and how Isolite can help you in there, please let us know. Dr. Hirsch, again, thank you so much for doing that. Really appreciate it. Looking forward to your next case. They're really cool. Have a wonderful rest of your week.
Hey, everybody, thanks a lot for viewing, and come back next week and we'll see what's on the agenda for next week. I'll
All
talk to you
right.
later. Bye.
Take care. Thank you, sir.